Now I'd love to introduce our next conversation, the digitization of healthcare. Janani leads the enterprise engineering team responsible for driving tech strategy. Over the last 20 plus years, she has worked at multiple divisions of Optum and led many enterprise modernization initiatives. She has a passion for researching, developing, and implementing innovative solutions and onboarded new technologies for enterprise adoption. She's also an open source advocate and has spoken in various conferences. Joining her today, we have Madhavi, who is leading engineering strategy to build products and platforms by transforming healthcare into digitalization to serve and respond faster to help people live healthier lives. Madhavi is a certified healthcare professional with over 25 years of experience working in multiple business segments such as finance, transportation, and healthcare, and leads enterprise big bets for Optum for enterprise engineering initiatives. And last but not least, we have Latha, who leads the enterprise clinical platform core engineering, platform architecture, and experience. Latha migrated to the US as a software engineer 20 years ago with a master's in computer applications in India. Inspired by many amazing leaders, she developed into a strong leader in software engineering. She's passionate about solving complex business problems with technology, developing global teams, and moving the needle in technology transformation. Thank you, all three of you, for being here, and please take it away.
Thank you.
Thank you. Raquel, I think you're on mute.
Yeah, you're on mute.
And it was so great. I sounded perfect. Good morning, everyone. Welcome, welcome. I'm Raquel Grenade, Enterprise Account Exec here at Power to Fly. Very much welcome to Janani, Madhavi, and Latha. We're so happy to have you here to talk about UnitedHealth Group's digitization of healthcare and the role each of you are playing in that. To start us off, could each of you tell us or briefly share what it is that you actually do at UnitedHealth Group?
Whom do you want to go? You want?
Why don't we just do it alphabetically? So Janani, you go ahead and start first.
Hi, good morning all. Thank you so much for the opportunity. And then like the introduction was mentioned earlier, I lead the enterprise engineering team for the home and community, and Optum being a big enterprise. One of the segments is where I work, and over the 20 years in Optum, I have led many initiatives, enterprise initiatives, and onboarded many new platforms at Optum. Currently, I'm leveraging those platforms to solve some of our business problems. Like we mentioned earlier, with COVID being in highlight right now, how are we going to enable self-service and virtual care for our member and patient population is the highest priority. And that's what I'm working right now.
Fantastic. So since we're keeping it alphabetical, Latha?
Yeah, hi, this is Latha Budideti. I live in Minnesota in the United States, and that's where our UnitedHealth Group headquarters are. I'm working from 12 years here in Optum UnitedHealth Group company, and I lead platform, like I mentioned in the introduction, I lead the platform engineering and the architecture, mostly advanced technologies, transforming the IT systems and solutions to help provide the more modern and advanced solutions to our members.
Oh, fantastic. Okay, lastly, Madhavi, tell us about your
Hi, good morning, everyone. This is Madhavi Gurijala. I am living in United States for past 25 years, serving for the healthcare organizations and various organizations, mainly within the UnitedHealth Group. I have been working as an engineering product platform leader to be able to build the products, digitalized products, so that can respond quickly to serve our members and payers. So we help our vision, UnitedHealth Group vision, that helping people to live healthier lives. The digitalization really picking up as we all know, as part of the world, and we all understood the criticality of that digitalization during especially COVID is a big eye opener. Everybody understood. We need that digitalization, but how massively it is required to support across the population is something as a huge eye-opener for products to be built in a transforming way that we can respond quickly and be able to take care of the population.
Fantastic. Now, as Asian women in leadership positions at UHG, what do you feel your visibility does for other Asian women in your industry?
You want to go again in alphabetical order, Raquel?
Sure. Yeah, that'll make things easy.
Okay, go ahead, Janani.
Yeah, again, Optum, I started my career here, and Optum it's a huge enterprise where I have been given a lot of opportunities. And in this role, we have women leadership forums in Optum where women network and mentor, coach, and also we sponsor. And I am part of the forum. And what we see is that when we show up authentically at work, we can bring ourselves as a whole, which will benefit everyone on the team. And what we see here is that, by encouraging others to bring themselves, and the unique perspectives, we enable innovation, diversity, equity, inclusion, and everything will flow naturally. And that's what, me in my role, we try to influence that in Optum.
Fantastic.
Yeah, thank you, Janani. So for me, I think, Raquel, I can say a couple things very proudly. One is I have 50% of women in my leadership team currently. So that's I think amazing to see women equally contributing in everything what we do here. And the way that we have set up is encouraging women in technology by giving them the opportunities and make sure that we are giving the not only the opportunities, the training, getting them up to ready. Like Janani mentioned, we do have a lot of forums in the company to make sure that we are coaching and providing the tools and process to make sure that they can thrive in the roles that we are in IT leadership positions. The second thing, I just want to make sure, in that innovation, it's always risk taking, right? Sometimes when we are innovating, things work, sometimes it won't work. So how do we fail fast? Or how do we create a safe environment to fail, right? Those are the things that we have created an ecosystem to be able to failure is not a bad thing, right? It's not a taboo. It is not a, so we do have an environment where women or anybody, to innovate, to thrive in the environment. And I just want to mention one more thing, how are we impacting, Madhavi and Janani, including me. It's amazing to see. Sometimes we feel that, oh my God, what are we making? Sometimes it shows in the action, right? Recently, last year, I spoke in our CIO's town hall. We have about 35,000 people in IT in Optum. And I spoke about the platform in CIO's town hall. I received about 200 pings after the town hall. It's like amazing to see a women technology leader in that stage alongside with our CIO. So that is the impact that all three of us are making in the company, is like just showing the example. And many women, we had many leaders, ahead of us that, showed us the path, and we are doing the same thing to our next generation.
That's fantastic. Madhavi?
Yeah, thank you. Well said, Latha. I was one of them when Latha presented in that town hall, pinging her first. Great job. It's an inspiration to see how UnitedHealth Group is supporting women to step up and take those challenges and all. So to my experience, I do see that in general, women itself standing in those critical positions with authority and influence, people feel much closer to us. They want to come closer to us, be feeling that we are confident, we are comfortable, and towards their dreams, whatever the dreams that they have, they believe in, my dreams can be met when they see us in those positions, when we are presenting ourselves, the hopes, the dreams that we are, indirectly, we are reflecting and helping them to achieve those, right? So to me, I think the visibility is not enough as a women leaders. We need to start embracing, advocating those communities to be able to step forward and take those challenges and embracing those new challenges, especially, and keeping up with the market trends. So as going back to Janani point, we mentor, we coach across the organization, many women, that includes many of Asian women as well, to help them to succeed in their careers, and also share our experiences that what we go through. It's not easy, it's tough to succeed as a woman in those leadership positions. We're not used to this. We're not packaged to it. We're sensitive. We feel we feel that we are pushed back, but we've been getting ourselves forward and forward, and also trying to bring the community of those women leaders to step forward and take those challenges to have those dreams succeeded.
That's fantastic. Well, that brings up another question. Madhavi, in your role in engineering, do you work to strategize the best ways to digitize healthcare? And how does digitization enhance healthcare's accessibility?
Yes. So the digitalization, as I was calling earlier, the digitalization is in a convergence between coming together the technology, the healthcare, the medicine, the payers and patients, consumers, all together to see how the digitalization of transformation can lead to bring in the problems that we are currently facing. So the biggest problems I often see is, how can I am in a hospital, how can I get in a faster approval of my prior authorization that I can be taken care quickly and take those surgeries in place and post-acute care and all of that. So the digitalization we are building with a broader vision of bringing the culture of reusability and integrating those products quickly, speak end-to-end the same language with the platform that Latha and her team are supporting, to use that platform and embrace that end-to-end connection to be able to speak the same language across the critical complex system of the healthcare, and be able to support, quickly respond to the physicians, to the consumers, to the payers, and also being able to bring that member experience faster. Right? It's all about connecting with the human, right? United Healthcare is all about whatever the products we are building starts continuously connect with the people and give the human culture as the first before we solve any problems using any of the engineering technologies.
Very good, very good. Latha, you've spoken about your childhood being raised in a matriarchal home. How do technology advances in healthcare create greater gender equality in healthcare?
Yeah, sure. Yes, Raquel. We were three sisters raised by my mom and grandma. They are my role models. United Health Group, we have a great vision. Our vision is to help people live healthier lives. We seek to enhance the performance of health system and improve the overall health and well-being of the people we serve and their communities as well. Innovation is one of the, we have 5 core values in Optum, and one of the core value is innovation. How do we create innovative solutions for our members? And technology is in the center of everything. I know how we advance to provide the solutions. Like Madhavi mentioned, my clinical platform team, we helped build and roll out Optum virtual care in the pandemic, which provides the care in their fingertips, right? Our members are using the technology to talk to the doctor. They don't have to rush to the urgent care. That is amazing, how we quickly built it and rolled out throughout the country last year. And one of the other initiatives we are focused on, comprehensive approach to reduce disparities and improve care and outcomes for everyone across the care continuum, specifically for maternal health and healthy pregnancy programs. Right? We are relying on data and analytics to eliminate any race-based guidance and any resulting, health disparities. Data and how we use technology is in the core to be able to provide those solutions quickly to the market. And from a gender equity perspective, looking at the other side as well, There is actually early evidence that technology may be helping men to be more open to therapy and mental health care as well, right? Just looking at the other side of the coin as well. So there are long-standing trends for women being more likely to seek and receive mental health, but compared to men. So technology may increase the privacy and reduce stigma. So men are open to receiving care. I mean, these are the few things that we are doing, but we are a company with great mission. So it's so fulfilling to see that what we are doing as a technology people, helping people in more impactful way.
That's fantastic. And the next question, Janani, you're an advocate of open source software development. Is there a role for this in revolutionizing healthcare?
Yeah, definitely. I want to echo and start with what Latha had mentioned, right? So core to our cultural value is innovation. And, out of the 5, integrity, compassion, relationships, innovation, and performance, right? So our fundamental role is to make the healthcare work for everyone. What that means is, we want to invent the future and learn from the past. And again, to reiterate what Optum is all about, right? So across Optum, we are able to serve many constituents, and we are very grateful to work and partner with 9 out of the 10 Fortune 100 companies, right? 9 out of the 10 US hospitals. What does it really mean from technology and open source? How do we enable all this constituent and how do we serve them is one of the things that we all work together, right? So in Optum, right, we have 99% of our workloads which run in our own data center, and we are serving over 1 trillion transactions annually. So these workloads, right, they vary from mainframe, big data, accelerators, containers, and serverless, right? We have our own open source serverless platform at Optum, and we are catching up with the technology industry. And one of the things, again, we wanted to reiterate what Madhavi had mentioned, how do we enable self-service to our member population? How do we enable the virtual care, video-based, care for our patients? So what we have done is at Optum, our entire open source project or the program is led by a women leader. She's a senior director of technology. Her name is Destiny DB Babjack. So in terms of our industry contribution, we want to be the consumers of the technologies to solve the healthcare problem, and we also want to enable and give it back to the community. So we have over 186 approved external communities. I'm going to put the link in the chat here too quickly, where we have been able to give it back to the community. We are one of the key contributors of the Knative serverless platform. It's an open source. We have hundreds of open source contributions and dozens of open source projects. If you're familiar with DCE, which is a disposable cloud environment, it'll help you to quickly and safely explore the public cloud, and you can manage your temporary AWS accounts. Another one to bring it to your attention here is Project Barista. It's also an open source solution for how do you manage your open source license and vulnerability management. This is another contribution from Optum. And there's also another one called Benthos. Benthos, it solves a common data engineering. We are all familiar with the data engineering pipeline, that you can do it in a configurable fashion with all the unit testing, everything enabled for you. So this will allow you to easily and incrementally build your data pipelines and let you to do catch up with your, the code revisions and others. So these are the high level things that we are giving back to the community as well as consumers of the open source technology, again, to solve the healthcare ecosystem problem.
So let me ask this. How many people are diverse individuals are each of you looking to bring on this year for your various teams?
As many as we can.
Is there a set number? Is it 30, 50?
I mean, see, like I said, we really do not want to go by numbers, right? Then if you want to meet the numbers, then you're definitely, not in the right path. We are organically growing to make sure that we have, all age, no discrimination against age or the race or the gender. So that is why I have, like I said, I have 50% of women in my team, in my leadership team. So we do have right now all programs, even when we are going to interviews for college graduates. We have a great program, TDP program, Technology Development Program, where we go to the colleges and hire fresh graduates. And even in the TDP program, we are making sure that we are very inclusive and bringing the equity. Our CIO level have DEI goals as well. So we are bringing in, making sure that we are constantly working on that.
Great. Madhavi?
We are trying to concentrate more from especially a product engineering with the platform culture, right? So we are looking for, in fact, I have more women as well working with my organization. One of the persons was asking, wow, you have a lot more women than anyone. Well, we are big promoters. We want to bring in the young women, get into this platform culture and engineering culture, be able to work with us closely and grow themselves, right? We're also trying to, in the same time, we're also trying to understand the challenges. What are those cultural challenges block them not to get themselves into this kind of a roles or to the platform engineering side? So we're working with the leaders. We always talk about it, Latha, and Jen, we always get into those discussions and see, we know better than anyone what those challenges are because we came from there, right? So we're trying to work on as the world is evolving, there may be different challenges now comparing with us, right? So we're trying to understand those challenges and see how can we help these women to get forward and solve the problems. Like one of the things I was talking to is, why can't we allow women work from home? It's COVID now opened and allowing us to think differently. The culture is changing a lot, right? So we are talking about it and trying to bring in more maturity and coach the young generations to be able to get on to this engineering product development and platform, and of course the innovation, right? So we are helping them to be able to grow there.
Fantastic. And then Janani,
Yep.
what about you?
I'm not going to echo and repeat what Latha and Madhavi had mentioned, but yes, Optum has been enabling this, women in technology, women in STEM. And I also want to highlight some of the programs that we all have led and participated is enable the parents to bring in their daughters to our I should say company and showcase them how our innovation center, enabling them to think through, starting from grade 6 and above, how we are enabling how STEM is very, very important for us to solve some of the healthcare problem, how we are enabling and using the STEM to solve some of these problems. So we do have summer camps and other things that we enable apart from what Latha and Madhavi had mentioned. So very happy to say that it's both, where our leadership is enabling us to grow. We are here because of them, and we are also enabling the same to others as we go through this journey.
Okay.
And then are you each in ERG groups, or are there ERG groups specifically for Asian women at the organization, or employee resource groups?
We have women groups, Raquel, in IT. So in information technology within our group. So we three are part of that group. Yes.
And is that where your mentorship comes from? Mentoring women who are smaller or younger in the organization, or not as advanced? Yeah. So you each are mentoring? Oh, fantastic.
That's a social group, Raquel. And we also have, Optum is heavily investing on training from like eCornell. Like I know Madhavi and Janani recently finished partnering with Cornell University. There is a program, a Women in Executive program. So Optum has many training programs as well that we are investing to coach women to grow in the career path for executives and so on. So eCornell, and I think there are 10 of them that are going on right now, Raquel.
Oh, wow, that's fantastic. Well, I know we're getting pretty close to wrapping. I just want to find out, is there anything else that you'd like to share with the audience today around digitalization, I guess I should say?
First of all, thank you for hosting Power to Fly. It's amazing. The title, it says itself. I have not heard this before. And then this is amazing when I went through your website and the mission, what you guys are doing. So thank you for inviting us and be part of this, at least express what we have done and what, within Optum and, how is it helping us and our next generation. Thank you for having us.
Oh, it was my pleasure.
I would say
Absolutely.
Thank you for Power to Fly. I mean, the words itself are very inspirational to all of us to feel believe, yes, Power to Fly. My words to all the women right there is believe in yourself. You are the one and only can believe yourself. And that's the only thing carry you forward for your future. Anytime that will let you deal with any difficulties and challenges. We're all here because we believed in ourselves all the time.
Fantastic. Janani?
Yeah, Madhavi, it's really inspiring, your speech. So again, it's a great opportunity for Optum, and thank you to Power to Fly. And then, like we said, right, once we see ourselves up, right, confident, be very confident, right, authentically, approach things authentically and with confidence at work, and always see the opportunity to help others. And that's why we are here. I really wanted to take it as like a paid forward. That's my mission here so far. So thank you again.
That was beautiful. Ladies, thank you so much for participating and sharing your stories. It's so nice to see women in leadership and hear what you've done to get there and hear the fact that you're helping to pay it back. So not only do we appreciate having you here, but we very much appreciated learning from you today.
Thank you all.
Thank you.
Thank you.
Thank you.